Hi, I'm Dr. Piechowiak, and I'm an interventional radiologist with IR centers. So I'm going to talk to you about varicocele. So when a patient has a varicocele, there is painful distension in the scrotum. There's venous engorgement that usually increases throughout the day, and it often leads to significant discomfort, aching, and even infertility. What are the treatments for varicocele? There are basically two treatments. There's surgical treatment and something that we offer, which is a varicocele embolization. It is a minimally invasive procedure that does not involve a surgical incision. So that's an attractive option for many people. It's 90% effective in reducing the symptoms associated with varicocele. So how do we do the procedure? We make a small puncture either in the neck or in the groin, and through there we place a catheter into what's called the gonadal vein. The problem in varicocele, when there are incompetent valves that aren't allowing the blood to flow back to the heart, these valves are supposed to act as one-way valves to prevent backflow, but when these valves aren't working properly, the blood will go down the gonadal vein and distend in the scrotum. So we place a catheter into the gonadal vein, which in a patient who has varicocele, this vein is incompetent. The valves are not working. And so this vein is not serving the patient anymore. It's only causing a problem. So what we're doing is we're going into this vein and blocking it off with coils, and that prevents the backflow of blood into the scrotum. So once we block off the abnormal blood flow to the scrotum, the engorgement will start to go away over time. After the procedure, some patients can start to notice improvements at 2 weeks, but it can take up to 3 months for patients to notice improvements in their discomfort and aching. And if their fertility is actually associated with the varicocele, it can take up to 3 months to restore fertility. So on the day of the procedure, we like that you come an hour early, and we will get you ready for the procedure during that time. The procedure itself takes approximately 45 minutes, and then afterwards you'll be in recovery for another 45 minutes. After that, you can go home and essentially go about your day.